Hey folks, Vic here for thepracticalprepper.com. I've been wanting to do a review on this book for quite a while. I picked up the Doom and Bloom Survival Medicine Handbook in 2012, sometime last year, and it was Dr. Bones and Nurse Amy's first book to come out with on survival medicine, and it is an excellent book. I have reviewed one or two others, medical books, and this one by far gives you much more information, much more hands-on information. And now that they've come out with this, which is their second edition, revised and expanded survival medicine handbook, that has improved even more. So to jump right in, you can see that they are physically two different sizes. The second edition, revised and expanded, a little bit physically larger, but not much at all. The original 2012, this book is 411 pages, and the new one is 539 pages. A lot of things that they've added in the new one is they have added a lot more history, a lot more remedies and treatments, and they've actually corrected a few items that I kind of disagreed with, and in my opinion weren't the established norm of the survival and prepper community. Now, they're medical professionals and I'm not, and I will be the first one to tell you that. That's why I have their book. If I'd gone through 12 years of college, I could probably not have their book. But for those of us who are going to end up in a medical role, or someone in our group is going to end up in a medical role, or someone in our family is going to end up being the medic, being the doctor, being the nurse, having a good book is invaluable, and having it in print is invaluable. So you can put this on your Kindle, you can download this to your computer, but when power fails, maybe you don't get to those books. So having something you can put in your hand, you can read, and physically put in your bug out bag if you like, could be worth its weight in gold. So there's a couple things in this book that I really do like, and that is that they have put a much bigger emphasis on some of the lists, from small IFAC lists, personal lists, personal medical lists, to larger groups, to community bag. And they've kind of it's just kind of gotten bigger with more interesting items, more higher end items. You know, in a personal, you may not have a sigmometer, but, you know, in the larger kits, you absolutely do. Real quick, the table of contents is roughly the same. I kind of like doing this side by side. You really get to see the difference. Table of contents of the old, table of contents of the new. And hygiene, sanitation, infections, environmental factors. Pretty much they have the same section numbers, same section headings, but they've offered a lot more information in those sections. So injuries, chronic medical problems, other important medical issues, medications, and then references. And honestly, I think you could take this book and a PDR and kind of have most of what you really need. So this one has kind of the same thing. And then they kind of go into, they've got a nice introduction in this book. They'll actually go into kind of this, everything is kind of expanded. It's pretty much the same, but expanded, and then in certain chapters they've added other sections to it. So here's Principles of Medical Preparedness, which I really do like. I'll tell you right off the bat, if I had my choice of any two books, of course, this is going to be the book. The original medicine book, they were trying to, and they did succeed in teaching us how to take care of ourselves when we need medical assistance. And of course, as most books are, they are predicated on the fact that you're going to be able to get yourself at some point to a hospital, to an ER, to wherever you need to get that next level of help. The Survival Medicine Handbook was written as though that help may be long coming down the road. So you're going to have to do kind of everything yourself. I'll show you one instance here between the two books. This is called Patient Transport. And I'll kind of briefly show you the difference in the two books. So I kind of like this side by side. So there's page 1 of either Patient Transport. And then you go over to this one, and you've got one little puppet carrying another puppet. And in the new book, you've still got the puppet here, but you've got some really nice sketches. How to do a back carry, how to do a blanket pull. And then basically remembering how to lift. So as you can see, that's just a bunch more information in the same chapter. So they go through a lot of neat stuff. Now, one of the things that they've really kind of expanded on, and let me move that out of the way, because if there's a book that you want, this is the one. If you have this one, I would put this in one of your bug-out bags, maybe your wife's bug-out bag, and then put this in the other bug-out bag after you've read it. It can't hurt to have your bug-out bags. You know, my philosophy is your bug-out bag is always with you, so it's no farther than maybe your car. The nice thing about this, and I have gotten into some of the essential oils with Stephanie Erickson. She's a doTERRA rep, and I did a video with her. And if you need someone to get in contact with for essential oils, she is simply outstanding. Very passionate about essential oils. They work really well in her life. And the nice thing about their book is they have put some, Dr. Bones and Nurse Amy have put some other alternatives. For example, if you look at this, this is minor wounds. And here's kind of descriptions of what you have. Easily treated, wash the wound anywhere the epidermis has been violated. Use antiseptic such as betadine, such. Minor bleeding, apply pressure if ice. Liquid skin bandage next way. New skin cure. They give you all kinds of things. These are conventional. Then you get down into some unconventional, such as they say you don't always have to travel a traditional road to treat medical problems. If you have one of the minor injuries mentioned, why not consider natural remedies? And so the nice thing about the book is that it is giving you alternative methods outside of the standard practices. So you may have that available to you and not this. So really what they go into essential oils and medicinal herbs. And both you should definitely take a look at. I know doTERRA has a kit that's for preppers, and it will do water purification and a bunch of other things. And you know, minor bleeding, for example, they go through here. Minor bleeding can be stopped, cleaned with an herbal antiseptic. And here's some pain relievers you can use, some natural pain relievers. And they kind of give you ideas of what to do. Naturopaths, such as activated charcoal, help wounds, and how to put that together and make looks like a poultice. Yep, you're making a poultice out of it. So it's really interesting, and it's nice that that is in there. It's always an alternative. You know, if you're at your bug out location, there's been a huge major earthquake or Titawaki or whatever you have on your horizon, whatever's happened, you'll have the chance to look around and decide, I have some alternatives and I have some things that I can do. So let me just take you through a brief flip section. There's eye care, headaches. Some of the stuff is really, really nice. There's some great drawings. There's some great pictures. You know, some of these things you really don't even want to think about having to treat in the field, but you know, the fact is, you may have to do it. So diabetes, thyroid, fractures. You know how to put fractures and fractures and traction. Excuse me. You know that one of the nice things is they do go through the whole argument of when to stitch and when not to stitch. And of course they tell you how to suture. But I actually did this with them at the 2010 preparedness show that was in Salt Lake City, Utah. I met with them and got to sit in and suture up a piece of a pig. So it was quite interesting to do. The question, of course, is when to and when not to. And so that was a particular drain. Here's a drain that you may have to put in, and here you go. When to close a wound, when to leave a wound open. Closing it is not always the right thing to do, and they go right into it, which is really nice. Let's see, let's jump through here a little bit. Minor wounds, of course, we looked at that a little bit. Biological warfare, radiation sickness, allergic reaction, anaphylaxis. So you really need to know this because there are so many allergies coming out today, especially kids with peanut allergies and such. And part of your kit should be an EpiPen. And you can probably get that from your doctor. Just get a prescription and tell them it's for your med kit. And sometimes maybe that person that you need to treat doesn't have their EpiPen with them. So, yeah, earthquake, storm preparedness, smoke inhalation, heat-related injuries, mosquito, tetanus. I mean, they really go through a ton of stuff, from basic food poisoning, sterilizing food, protective masks. Now they get into more of the gear and things to do, dental issues. Now let me flip over. Let me find their lists. Okay, here we go. So here's supplies, and then here's some other things too. Medical skills you'll want to learn. Really good section. You know, how to take vital signs, pulse, respiration rates, and BPs. And how to do that through palpation, maybe, and not generally from looking at a sigmometer. So there's lots of stuff there. And the medical supplies, sterile versus clean, is interesting. It's autoclave versus another method. Here's your IFET personal carry kit. And then you go into your nuclear family kit. Then you move up to a medic at away camp list. So medical supplies for an expedition. The community clinic. This is long-term care. So this stuff, you're getting into much larger items and really much more big-ticket items. And some stuff you're going to have to work to get. And here's some extra additional prescription medicines and such you should think about for your kit. And then they have a whole section on natural remedies. Teas, essential oil salves, tinctures, and then they have a section right here on essential oils. Like I say, if you look at the other video that I put up on essential oils, Stephanie goes through a lot of this stuff. And if you really want a good source just for essential oils, she is a great one to go to. That's Stephanie Erickson. And take a look at that video. I will also put her information up at the end of this video should you want to take a look at it. So there's a lot of really good stuff in here. My wife grabbed this book when I had something that lodged in my foot. It was a really large splinter, and so she actually looked at this book to get if there are any other recommendations to get it out of there. And a couple of theirs did work. One thing I realized by looking at this is I don't have enough disposable scalpels, and those come in real handy even for little splinters. It's very quick, very easy, and helps you minimize really the pain of the patient. And I didn't realize that until we kind of looked at the book and went, oh, geez, that really makes sense. So my review is absolutely thoroughly excellent book. And both these folks, Dr. Bones and Nurse Amy, are just really, really nice people. So if you want to take a look at this book, there's a link at the bottom of this video where you can get it, and I'll throw it on there. And with that, I'll say take a look at the book and see what you got, and we will talk to you again. Take care.